Today we're going to be palpating the rotator cuff tendons, and we're going to start with the supraspinatus tendon. So supraspinatus tendon inserts on the greater tubercle, and a great way to expose this is to put the shoulder in internal rotation. So you ask the patient to put their arm behind their back. Okay? Now the tendon is exposed. So how do you get there? You go from the spine of the scapula, and then you go up until you feel the shift in direction with the acromion. And then you can palpate from the clavicle to the anterior portion of the acromion. And then you slide just downwards, and you should feel a little bump. And then you ask the patient to resist your movement. Yeah. And you should feel the tendon pop into your fingers. Yeah. One more time. Yeah. Literally right here. Again. Mm-hmm. Yeah. For the infraspinatus tendon and teres minor, because they're in close proximity to each other, it's going to be the same movement. We're just going to palpate a little bit lower for the tendon. Okay, so to get the feel for these tendons, you're going to ask the patient to sit down on a chair, and you're going to make sure that their arms are at 90 degrees, roughly. Okay, you're going to put the arm in slight adduction, like this, and slight external rotation. Okay. And then you're going to palpate the acromion, which is roughly here, and you're going to go posteriorly and laterally. And then you ask the patient to resist the movement. Again. And then you should feel the tendon pop into your hands. Okay, you might be able to see it. Ready? Right here. One more time. See that? Mm-hmm. And then you go slight posteriorly. Again. And you feel the tendon dissolve.
And so which one's more posterior? Which one's more?
So the one that's going to be higher up is the infraspinatus. So again, we can find the acromion, and then you go posterior lateral. You ask the patient to don't move you. There we go. Okay, one more time. And then you go slightly below. One more time. And yeah. So the first one would be infraspinatus, and the bottom one would be teres minor. And for the last tendon, the subscapularis tendon, that one inserts on the lesser tubercle, and it's mostly exposed when you're in a lateral rotation of the shoulder. So, same concept here. You're gonna find the acromion again, okay? And then you're gonna drop down to find the greater and lesser tubercles. You might not feel it at first, so just play around until you start feeling a bump, dip, bump, okay? So that's the greater, dip, lesser, and then you ask the patient to keep this position, and then you're going to push against them and say, don't let me move you. And you should feel the tendon pop right into your finger. One more time. Be loose. Again. Yeah. Again. Yeah. We're going to do active range of motion now for the elbow. We're going to start off with flexion and extension. Okay, so for flexion, we're going to ask the patient to put their arms out in front and to just touch their shoulders with the fingertips and put them back down. And now can you do the right arm one at a time? And then you're going to come here, support the elbow joint, and you're going to put over pressure. And you're looking for a soft tissue and feel because of the bicep. Okay, and then you do the other side. Same thing. Over pressure. Any pain?
Yeah, Ariel.
Yeah, so now we're going to do elbow extension. Sorry. You're going to ask the patient to extend their arms. Any pain?
No.
Okay, so we'll just do this one at a time. And then you're going to grab right above the elbow joint. You're going to get close to the elbow joint, and you're going to overpressure. Any pain?
No.
And then the other arm. Same concept. Any pain? Okay. Cool. And we're back. So now we're going to do active range of motion for supine and pronation. So we're going to ask the patient to just put your palms facing outwards. Okay, you're going to come and support the elbow joint, and you're going to put over pressure. Any pain?
No.
Okay, and you do the same thing for the other arm. Any pain? And then support the elbow joint, over pressure. Any pain? And now you're going to ask them to do the opposite. So can you put your palms facing downwards? Do you feel any pain with that?
No.
So you support the elbow joint, and you go down. Any pain? The other side. Any pain? And then support the elbow joint. Any pain? Okay, so now we're gonna do passive range of motion for the elbow joint. You're gonna ask the patient to lie down on their back. Usually you would have a pillow to support the head, but we don't have that right now. So for elbow flexion, you're gonna start like this. Okay, you're gonna just support the humerus on the side here. You're not going underneath the elbow joint, you're supporting it on the side. And you're gonna tell the patient just to be loose and to let me guide the movement. Okay, so don't do anything. You're gonna go like this. Any pain?
No.
Over pressure, close to the joint. Any pain?
No.
Okay. And now for elbow flexion, you're just gonna move a little bit to the side. Extension, you're gonna move a bit to the side. You're gonna support the elbow joint. Okay. And you're just gonna drop the arm. Any pain?
No.
Okay. And then over pressure, any pain?
No.
Okay, and you're looking for that bony end feel. Okay. And for supination and pronation, you're gonna keep the same position, elbow underneath the hand underneath the elbow joint, and you're gonna pronate. Any pain?
No.
Okay, and then supinate. Any pain?
No.
Okay. We're gonna do Risom for the elbow flexion, extension, supination, and pronation. So for elbow flexion, we're gonna start having the patient like this, 90 degrees. Okay, and you're gonna come support the elbow joint. And now you want the patient to match your strength. Okay, so you say, don't let me move you. 1, 2, 3, 4, 5. Any pain?
No.
Okay. And then for elbow flexion, you would just bring the arm slightly above. Support the elbow joint as well. And if the patient is stronger than you, then you can get a good base of support and use your body weight. Okay, PT biomechanics, remember. Okay, and then you tell the patient, don't let me move you. 1, 2, 3, 4, 5. Any pain?
No.
Okay. So now we're gonna do supination and pronation. So we're gonna start with supination. Okay, you're gonna ask the patient to put their arms like this to the side, make a fist. Okay. And as the physiotherapist, okay, you want to have your hand not too close to the wrist joint, but just a little bit further so you get the actual bone that's turning, right? Okay. And then when you interlace your fingers, you want to make sure that you're also not just getting the skin, but you also have control of the bone itself. Okay. So we're just going to ask the patient to don't let me move you. Okay. I'm going to push in supination, so that means I'm resisting pronation. Okay. You ready? Go 1, 2, 3, 4, 5. Okay. And the other side. 1, 2, 3, 4, 5. So when I was pushing inwards, I was resisting supination. When I was pushing outwards, I was resisting pronation. Okay? Any pain with that?
No.
Okay.